Can you tell me when a patient should have surgery and what types of surgery may be discussed with a patient for breast cancer?
So usually, we always say surgery is the primary treatment for breast cancer. However, sometimes it's not the first treatment, and that depends on the stage of cancer, the size of, and the stage includes the size of the tumor. Sometimes we would recommend neoadjuvant chemo, we know that. But let's focus on the types of surgery, types of cancer where surgery is the first treatment. When surgery is the first treatment, there's two options: lumpectomy with radiation or mastectomy. And the reason why I lump radiation in there, because radiation with lumpectomy is the standard guideline treatment. It still is. So lumpectomy is the removal of a area of the tumor with an area of healthy tissue around it. The mastectomy is the removal of the entire breast. And in addition to the mastectomy, we have mastectomy with breast reconstruction, and that is the creation of a breast. And that can be in the form of using an implant, which can be saline or silicone, or using a flap from your belly, which can be your abdominal flap, or you can use maybe the latissimus dorsi flap or some other area of your body, and just to create a breast. But most importantly, some women don't want reconstruction, and they can use a prosthesis. There are forms of breasts in the shape of, sometimes it's made out of different types of foams and sponges that they can insert into a bra, and it matches a cup C or D or whatever they may like, or it matches the other breasts if they have a unilateral mastectomy, and they can have balance with a prosthesis. Or sometimes a woman may just want not to have any reconstruction at all. But there is a difference in recurrence. Mastectomy is a 1 to 2% chance of recurrence in 5 to 10 years, and lumpectomy is a 5 to 10% chance of recurrence in 5 to 10 years, but there's no difference in survival. Well, in addition to that, there are so many other variations within the mastectomy group and different types of lumpectomies based on the size of the tumor and the location of the breast. So I'd say any patient, make sure they speak to their doctors about the options available to them. Make sure they are well informed. I do believe that the patient should have the choice, and all options should be explained to them, the pros and the cons, so that they can make the best decision, so they can have a good quality of life, because they have to wake up with themselves every day, and they got to be comfortable with their bodies.
So each patient's case is a little bit different,
It is different.
and there will be different options available that can be gone through with them by their surgeon.
Exactly. Yes. And they should demand it.